Hello, Dr. Schmaltz here. If you've been hurt in an auto accident and injured your neck, one of the common comments you may hear, especially from insurance adjusters, is, well, it's only a soft tissue injury. They say that in a demeaning or belittling way to make you think that your injury is not very significant. Unfortunately, that's far from the truth. In fact, there's a very common x-ray finding that helps demonstrate that there might be some permanent long-term problems to the ligaments of your neck. If you've had x-rays of your neck and you see where they tell you that you have a straight neck instead of a backward C, that's an indication there may be injury to the ligaments of your spinal bones in your neck. In 2005, they did a study. They did MRIs of necks of 100 non-injured people and 100 people who had been injured in low-impact injuries, which means there wasn't a lot of auto damage. What they found with this was very, very significant. They found only 4 of the non-injured people had a straight neck or a loss of curve. But what they did find is 98% of those who had been injured had a loss of curve. The other significant thing about that is it was 12 to 14 weeks after the injury when there was no muscle spasms present. Second of all, what they did is they also did MRIs of the patients bending their head forward and bending their head backwards. Now, the significance of this is it checks the stability of the ligaments that hold the spinal bones together. What they found is that in all 100 normal people, uninjured people, that the spinal motion was normal. But what they did find in the 98 individuals that had a loss of the neck curve or the straight neck, they found that they had abnormal motion in their neck, indicating the ligaments had been injured. And then another significant finding is they found in those 98% who had a straight neck, there's a much higher incidence of bulging or herniated discs. So the takeaway points are here. One, if you've been injured in an auto accident and they're telling you you have a straight neck or a loss of curve and it's due just to the muscle spasms, that's probably not correct. It's probably got to do with injury to the ligaments. Second of all, if they didn't take x-rays of you bending your head forwards and backwards, how can you evaluate the integrity or the strength of those ligaments that are supposed to be holding the spinal bones? So what I would advise you to do is give our office a call, 314-731-4383, 314-731-4383. Set up a time to come in so we can talk to you about your injury and what may be the next step to evaluate the seriousness of your injury.